Hi there, my name is Dr. Nathalie Cassis. I'm an optometrist practicing in Norfolk, Virginia in Envision Ghent Optometry. A couple years ago, I had the opportunity to move my office minutes from my house right here in the heart of Ghent after commuting to Newport News for the last 17 years, which was an average an hour and a half in the car. So this has been awesome. I started here full-time in January of 2020 and COVID hit in March, where we had that mandatory shutdown where we saw only emergency patients, which was a lot of time on my hands. I decided to dive in and really think of ways I could enhance and fulfill my mission in terms of providing amazing care to my patients and enhance their quality of life. So the most common complaint after my eyes are blurry is my eyes are dry. So I decided to add and learn and participate in actively treating dry eye. And what I started with was adding a piece of instrument that's called a keratograph, which allows us to analyze the tear film chemistry, components, blink rate, so on and so forth. And it gives us a pretty good idea of the dry eye patient that's sitting in the chair. From there, I added at-home maintenance and in-office treatment to get great results and get my patients a lot more comfortable. I see the dry eye treatment as teamwork, meaning the patient has to do work at home and then we do in-office procedures as well. So what we do for home maintenance is I use a lot of IECO products. I love the tea tree oil facial and lid cleanser. We offer 3 different types, so a lot of times we'll start with the gentle. I also have the 2% depending on the clinical picture and the severity of the dry eye patient. And we also have the anti-age formula, which I love, because let's face it, we all need a little help after a certain age. We combine our tea tree oil cleansers with some masks, so some heat treatment. So again, depending on the severity of the patient, we have the basic derm mask. And then I also have the Tranquilize, which will give us more sustained heat from 15 to 20 minutes. So all of that helps with the treatment for meibomian glands. The other thing I discovered and I really love is the night moisture goggles, the eye seals. So I use them myself. So that has been super beneficial to help patients that wake up feeling dry because they're exposed at night, whether they use a fan or their lid closure is not complete. So that enables us to really get great results. And now analyzing what the issue is and then targeting the treatment has been super beneficial. We also have in-office treatment. We start patients on home maintenance, see how they do, bring them back in 6 weeks, do a more detailed analysis of how things have progressed. And then from there, we'll make other recommendations, whether it be we have punctal plugs available, we do lid debridements, we have an iLux where we express the meibomian glands. We also have an IPL where we do treatments for patients that are highly inflamed and have a rosacea component to their dry eye. So I try to offer something for everybody from the mild to severe and fulfill my mission of enhancing quality of life and patient outcomes. Thank you.